Welcome to PharmaconHealth, your gateway to mastering pharmacology with science, simplicity, and clarity. Branches of Pharmacology Explained, a complete guide to how drugs work. Pharmacology is more than just knowing what a drug does. It's the science of how medications are discovered, developed, delivered, and deployed in the human body, and it is a field made up of many specialized branches. In this video, we'll dive deep into 16 core branches of pharmacology. Each plays a vital role in advancing medicine, improving therapy, and keeping patients safe. Stick around, and you might just discover which branch inspires your passion. Let's begin. 1. Pharmacodynamics. What drugs do to the body? Pharmacodynamics is the study of how drugs exert their effects at the target site in the body. It answers questions like, how does this drug lower blood pressure? Why does a small dose work for one drug but not another? What receptors or enzymes does this drug bind to? It focuses on 4 key concepts: mechanism of action, potency, efficacy, and the dose-response relationship. Take morphine, for example. It binds to opioid receptors in the central nervous system to reduce pain perception. The more precisely we understand this interaction, the better we can fine-tune dosing and minimize side effects. Pharmacodynamics helps us understand not just that a drug works, but how and why it works, too. Pharmacokinetics. What the body does to drugs. Pharmacokinetics, often abbreviated as PK, explores the journey of a drug through the body, commonly remembered as ADME, absorption, how the drug enters the bloodstream, distribution, how it spreads through body tissues, metabolism, how it's broken down, mainly by the liver, excretion, how it's eliminated, usually via the kidneys. Imagine taking an oral tablet. How much of it reaches the bloodstream? How fast is it cleared? Will it accumulate if taken daily? Drugs like warfarin or digoxin require close monitoring because of narrow therapeutic windows, a small difference between effective and toxic doses. Understanding pharmacokinetics helps optimize dosing schedules and prevent overdoses. 3. Clinical pharmacology, bridging lab to bedside. Clinical pharmacology is the application of pharmacological knowledge in real-world clinical settings. It investigates how drugs behave in different populations: the elderly, children, pregnant women, or patients with kidney or liver disease. It also evaluates drug interactions, side effects, and individual responses. For instance, why do some patients require a higher dose of an antidepressant, while others experience side effects at the standard dose? Clinical pharmacologists conduct trials, monitor therapeutic drug levels, and ensure evidence-based prescribing. They play a crucial role in personalized medicine and medication safety. 4. Toxicology. The study of harmful effects. Toxicology examines how drugs and chemicals cause harm. It spans acute poisoning, chronic exposure, carcinogenicity, teratogenicity, and organ-specific toxicity. For example, acetaminophen is safe in therapeutic doses but can cause liver failure and overdose. Chemotherapy drugs target cancer cells but can also damage healthy tissues. Toxicologists identify toxic doses, determine antidotes, and help regulators set safe exposure limits. This field also includes forensic toxicology, which detects toxins in criminal cases or post-mortem exams, and industrial toxicology, which assesses workplace chemical risks. 5. Pharmacotherapeutics, applying drugs in disease. Pharmacotherapeutics is where theory meets treatment. It's the science of choosing the right drug for the right patient at the right dose. It involves understanding the disease pathology, selecting appropriate drug classes, balancing benefits versus risks, monitoring treatment outcomes. For example, treating hypertension could involve ACE inhibitors, beta blockers, or diuretics. The best choice depends on the patient's age, comorbidities, and side effect profile. This branch is the heart of rational prescribing and clinical decision-making. 6. Neuropharmacology, drugs in the nervous system. Neuropharmacology studies how drugs affect the central and peripheral nervous systems. This includes treatments for depression and anxiety, Parkinson's disease, seizures, neuropathic pain, substance use disorders. It also covers receptor pharmacology, neurotransmitter modulation, and drug tolerance and dependence. A good example is levodopa, used in Parkinson's. It replenishes dopamine in the brain, improving motor symptoms. Understanding how it works and why its effect wanes over time is core to neuropharmacology. 7. Cardiovascular pharmacology, targeting the heart and vessels. This branch focuses on drugs that treat cardiovascular diseases, from hypertension to arrhythmias to heart failure. It includes vasodilators like nitroglycerin, antiplatelets like aspirin, beta blockers and ACE inhibitors, statins for cholesterol control, cardiovascular drugs are among the most prescribed globally. This field ensures that we reduce risk of heart attacks, strokes, and sudden cardiac death, while avoiding dangerous drug interactions and complications like electrolyte imbalances or bradycardia. 8. Psychopharmacology, mind-altering medications. Psychopharmacology explores how drugs influence mood, emotion, cognition, and behavior. Key drug classes include antidepressants, antipsychotics, mood stabilizers, anxiolytics, cognitive enhancers like those for Alzheimer's. This branch is especially complex due to brain chemistry, genetic variability, and the placebo effect. Treating psychiatric conditions requires balancing clinical efficacy with potential side effects like sedation, weight gain, or extrapyramidal symptoms. 9. Pharmacogenetics and pharmacogenomics. Personalized medicine. Pharmacogenetics and pharmacogenomics investigate how a person's genes affect their response to drugs. Some patients metabolize drugs too quickly or too slowly, leading to treatment failure or toxicity. For example, people with CYP2D6 mutations may poorly metabolize codeine. Patients with HLA-B*1502 are at risk of Stevens-Johnson syndrome from carbamazepine. This branch is revolutionizing medicine by enabling tailored therapy, choosing the right drug and dose based on your DNA. 10. Chemotherapy, fighting infections and cancer. Chemotherapy isn't just for cancer. It includes any drug that kills or inhibits harmful cells, including microbes. Sub-branches include antibiotics, bacterial infections, antivirals, HIV, COVID-19, herpes, antifungals, and antiparasitics, anti-cancer drugs, cytotoxics, targeted therapies, immunotherapies. Chemotherapy often walks a fine line between efficacy and toxicity. Understanding mechanisms of resistance, combination therapy, and selective toxicity is key to effective treatment. 11. Pharmacoeconomics, drugs and healthcare costs. Pharmacoeconomics assesses the value of drug therapy, balancing cost, effectiveness, and outcomes. It answers questions like, is this new drug worth the price? Should insurance cover it? What's the cost per life saved or quality-adjusted life year? This branch supports policy decisions, insurance coverage, and formulary management, ensuring that healthcare spending maximizes patient benefit. 12. Pharmacoepidemiology, drug use in populations. Pharmacoepidemiology combines pharmacology with public health. It studies drug utilization patterns, adverse drug event reporting, vaccine safety monitoring, real-world effectiveness. It's the science behind post-marketing surveillance. For instance, detecting rare side effects of a vaccine or monitoring inappropriate antibiotic use trends. It helps refine drug policies, support public health interventions, and guide prescriber behavior. 13. Veterinary pharmacology, medicine beyond humans. Veterinary pharmacology applies to animals, pets, livestock, zoo animals, and wildlife. Animals metabolize drugs differently. For instance, cats have limited glucuronidation ability. Horses require higher doses of some drugs due to size and metabolism. Withdrawal times must be calculated for food-producing animals to ensure drug residues don't enter the human food supply. This branch protects animal welfare and public health, especially in preventing drug residues in meat, milk, and eggs. 14. Environmental pharmacology, protecting ecosystems. Environmental pharmacology studies how pharmaceutical waste impacts the environment. Examples include antibiotics in water supplies, hormones from contraceptives affecting fish, drug manufacturing, pollution. It promotes eco-safe prescribing, green pharmacy practices, and biodegradable drug design. As global drug use increases, environmental pharmacology is critical for long-term ecological balance. 15. Molecular pharmacology, drug action at the cellular level. Molecular pharmacology dives deep into receptors, enzymes, signaling pathways, and gene expression. It explains how drugs activate or inhibit specific proteins, how signal transduction cascades work, how drugs can regulate gene transcription or protein synthesis. This branch forms the basis for biologic drugs, monoclonal antibodies, and gene therapy. It's where the future of precision medicine is being shaped. 16. Clinical toxicology. Emergency drug safety. Clinical toxicology focuses on diagnosing and managing drug poisoning and overdose. Common cases include opioid overdose treated with naloxone, acetaminophen toxicity managed with N-acetylcysteine, benzodiazepine reversal using flumazenol. This branch is vital in emergency medicine, ICU settings, suicide prevention, and poison control centers. It also addresses drug abuse, pediatric ingestion, and chemical exposures. Conclusion: a field of infinite depth. Pharmacology is not a single science, it's a vast web of interconnected disciplines. From understanding molecular interactions to evaluating public health outcomes, from treating a single patient to managing entire populations, each branch contributes to the ultimate goal: safe, effective, and responsible drug therapy. So, which branch intrigued you the most? Let us know in the comments, and don't forget to like, subscribe, and follow PharmaconHealth for more clear, clinical, and science-based videos on pharmacology, drug action, and health education. Thanks for watching, and stay curious.